it's been a while, and today we were going to be going over part 1 of all types of cancer. Now today specifically we're going to be going over cancer types that start with the letter A. Now starting off, we have acute myeloid leukemia. Now acute myeloid leukemia is a type of cancer where the bone marrow makes a mistake of creating an immense amount of abnormal blood cells within the body. Some causes of the disease include smoking, previous exposure to chemotherapy, or exposure to radiation. Symptoms include fever, infection, paleness, weakness, fatigue, or bleeding. However, there are some very good treatment options, such as chemotherapy, target therapy, and radiation therapy. But what is special about this is that the treatment of AML actually has 2 stages. And here you can see the diagram where we have the bone marrow. Next, we have adrenocortical carcinoma. Now, adrenocortical carcinoma is actually a rare disease where cancer cells start to form at the outer layer of the adrenal gland. But the special thing about adrenocortical carcinoma is mainly a genetic disease. Typically, those who have that disease also have mutations among the TP53 gene or the IGF2 gene. And symptoms of this condition include weight gain, hair growth, voice changes. Typically, your voice will get deeper. Also, if you're a woman, you may have irregular menstrual cycles. Some symptoms also include changes within the skin and back pain. However, there are many treatment options for this disease, such as surgery, radiation therapy, chemotherapy, ablative therapies, clinical trials, medication, and targeted therapy. Now here you can see the tumor was in the gland in the diagram. The adrenal gland is the gland just above the kidney. Now next we have AIDS-related lymphoma. Now AIDS-related lymphoma, like how the disease sounds, is a disease where cancer cells form within the lymph nodes of patients who have contracted AIDS, which is basically autoimmune deficiency. And just like AIDS, viral infections, mostly stemming from sexual contact and genetic abnormalities, are also factors that can increase one's likability of contracting that disease. Some symptoms include swollen lymph nodes, typically around the neck, underarm, or groin. Unexplained fevers, itchy skin, a feeling of fullness below the ribs, or drenching night sweats. However, there are treatment options such as chemotherapy, targeted therapy, radiation therapy, antiretroviral therapy, which is also known as ART, high-dose chemotherapy, or clinical trials. And you can see in the diagram the lymphatic system. And you can also see the lymph node. Next, we have anal cancer. Now, anal cancer is where harmful cancer cells start forming at typically the end of the anal canal. Now, some factors that can lead or increase one's susceptibility of contracting that disease include weakened immune systems or the contraction of the human papillomavirus, which is also known as HPV. Symptoms may include, oh, you can see I've made a typo here. It's not NPV, it's HPV. I'm sorry. And symptoms may include bleeding from the anus or rectum, itching or pain around the anus, limbs near the groin or anus, discharge of mucus from the anus, difficulty controlling bowel movements, feelings of fullness around the rectum. But there are treatment options such as chemotherapy, surgery, chemoradiation, immunotherapy, targeted therapies, and external beam radiation therapy. And as you can see here, you can see the anus right near the vagina, just like to the right of the vagina, and you can just see the systems around the bodies. Oh, yep. And next we have appendix cancer. Now, unlike some of the other forms of cancer, appendix cancer is actually an extremely rare disease, where cells in the appendix begin to mutate and grow out of control. Now, the causes of appendix cancer are mostly unknown, but there are some factors that may increase one's likelihood of contracting the disease, such as age and gender. Those over 50 are more likely to contract that disease, and women are also more likely to contract that disease. Yep. And some symptoms include nausea or vomiting, fever, constipation, or diarrhea, general fatigue, a mass in the abdomen, or pain in the right abdomen or pelvis. But there are many treatment options for appendix cancer, and you can see a couple of them. The first is probably one of the more common ways in appendectomy. There's also thyroidectomy surgery, peritonectomy, hemicolectomy, and last but not least, hypothermic intraperitoneal chemotherapy, which is also known as HPEC. And you can see the diagram, which is just a structure of the intestine. And you can see the appendix is actually near the cecum. It's that very, very small tip that's right below. And thank you. Thank you very much. Now, additionally, I just wanted to show you some more resources where you can discover more about the